welcome to another episode of Simply Healed, and we have together with us today again our Dr. Jansen Kalalan.
Hello everyone, glad to be here again.
Okay, today's topic is very pertinent and very important because for COVID-19, we always hear this term comorbidities. And today we're going to talk about one of the most common comorbidities in Philippines because of our love for iced tea, which is diabetes type 2. Hey, Dr. Jansen, I meet so many diabetologists, they believe that it cannot be reversed. But today you told us a good news, it can be reversed. So where's the authority that you are standing on that would let the diabetologists know that things have changed?
Okay, so we have at least three that I know of: the American College of Lifestyle Medicine, the Philippine College of Lifestyle Medicine, and the American Diabetes Association.
Wow,
okay.
The American Diabetes Association. I think that is very important. that is the defining association.
Yeah.
Wow.
So they already announced that hey, diabetes is reversible, and even gave a criteria on how we can say that.
Will you be sharing that criteria today?
At the end of the video, I'll be sharing it to you.
Alright, so there we have it. Absolute authority that diabetes type 2 can be reversed. So Doc, please share with us the good news.
Okay, first let's define what type 2 diabetes is.
Oh, that's
okay, so
important.
because this is the type of diabetes that is the one that is reversible. Okay, so type 2 diabetes is a metabolic disease where the body has an impaired ability to produce insulin or respond to insulin, causing an increase in the blood glucose levels. So, if you read this statement again, okay? So, the increase in blood glucose is just a symptom of an underlying cause or an underlying condition, okay? And we'll go to that later. So, what I just said, in short, is insulin resistance. Basically, what it means is that your insulin's function is decreased and your body is not responding well to your insulin anymore. So that is basically what insulin resistance is, and the whole of diabetes type 2. Okay?
So we have a video to show this, right?
Yeah.
Let's play the video.
Okay, so here is a muscle cell. Normally, in order for glucose to enter inside our cells to be used as fuel, we need insulin. Insulin attaches to an insulin receptor, which activates a number of enzymes, which then brings in the glucose transporter onto the surface of the cell, which acts as a gateway for glucose to enter. If there is no insulin, glucose just accumulates in the bloodstream, no way for it to enter our muscle cells. Therefore, blood sugar rises. This happens in type 1 diabetes.
Oh.
But what if there is enough insulin but it doesn't work? Something is gumming up the lock so that the key doesn't work. In this case, insulin attaches to the insulin receptor, but something is blocking the signaling pathway, preventing the glucose transporter from going to the cell surface. This is called insulin resistance. This is caused by fat inside the muscle cells, also known as intramyocellular fats. This mechanism was proven by this study.
Wow, Doc, so it's very easy to understand. So your body is not working simply because the key cannot go into the lock.
Yeah, exactly.
So the key cannot go into the lock because we ate too much
Fats.
yeah.
Or there is lipotoxicity that is going on already inside your body. So if the amount of fats that is inside your muscle cells are really high, then this happens.
So in other words, what the promise of a reversal is, if you can clean out the keyhole, then the body can the key can connect again, and you can be insulin sensitive again.
Yeah. So your body responds again.
Wow, very easy to understand, Doc. So here's the super question: how do you remove the gunk in the keyhole?
Okay.
How long does it take? Is it simple to do? Can we not exercise? Can we just take something and clear? Can we just when we clean the toilet, instead of having to use the plunger and smell everything, can we just pour something and clear the clog?
Okay. So the straight answer is no. You have to do the hard part. Okay. You have to do the work. Now, there are three concepts here, that you have to understand. So, the three concepts here is eat a whole food plant-based diet, exercise, and activate the PPAR receptors. Okay? So first, we go to the whole food plant-based diet. Why do we need to eat this type of diet? Isn't this high in carbohydrates?
Right? You can eat carbohydrates? I thought diabetics are always told, don't eat rice, don't eat bread.
Yeah.
Right.
Okay, so the main reason is a whole food plant-based diet is innately high in antioxidants, it's innately high in anti-inflammatory nutrients, and it's low in calories and fats. Okay? Now, if diabetes type 2 is really a disease of fat toxicity, guess what would happen if you eat a very low-fat diet, okay, that is high in nutrients, in antioxidants. Okay? So that is number one. Remove the added fats in your diet first. Remove the damage first, that one that is causing harm. Number two, you have to burn the fats. In order for you to burn the fats, you have to use them, okay? So what do you do when you to use them? You have to exercise. You have to move. How much exercise do we need? Not really much, you know. I mean, you can just do brisk walks, do cycling. If you want to know how much exercise you need to do, watch the other videos that we have recorded previously, okay? So next is activation of PPAR agonists. Okay, so this is where we come in, the supplements, okay? So PPARs, basically its main function for the diabetes, right? It's to actually burn the fats. It's to induce your body to burn fats.
Wow, okay? Doc, we actually have a lot of clients tell us that they didn't necessarily lost weight because sometimes their weight stays the same, but their waistline shrunk when they took the PPAR tablets.
It's the visceral fat that is most important for diabetes as well.
Oh, so that's what PPAR tablets actually do. They help you to burn
the fats. Yes, so that is what it is. PPAR tablets are gene activators, and the things that those genes activates is the fat metabolism pathway.
Whoa, that's good news. Noel, our videographer right now, this is good news for you.
Okay, so later I'll teach you what protocol I use for this. It's not just the PPAR tablets, no? Okay. Now, we already have the product that is naturally made, which have PPAR agonists that activates all PPARs. Now, PPARs, do we have medications that activates this? Yes, we do. These are the pioglitazones, the ZONES at the end of the name, you know. These are PPAR gamma agonists.
Like Actos and Avandia. These are actually PPAR drugs.
And also another type of drug, fenofibrate. So fenofibrate is the drug that decreases your triglycerides. See? It activates PPAR alpha.
Wow.
Okay, so the PPAR receptors are really a very useful tool in order to fix your metabolism. Now, of course, these are drugs, right? There are some of you, which we perfectly understand, that hates drugs as much as possible, who don't really want to take drugs. This is an answer for you. Okay, this is
totally natural PPAR tablets. Totally natural.
Totally natural.
And PPAR gamma and alpha.
Yeah, and one thing that is really good for here in the PPAR agonist that we have, it's made out of a natural food. So it's made out of a special strain of microalgae. So on top of the PPAR agonists that you get, you also get the nutrients, the antioxidants, the anti-inflammatory,
anti-COVID effect.
Yeah, so the entire package. Okay, so it's not just the drug.
Doc, you mentioned that PPAR alpha actually, since it helps to burn fat, is that one of the reasons why many of our diabetic clients, they also experience an improvement in their blood cholesterol levels?
Yes, exactly. This also decreases your cholesterol levels.
At the same time?
At the same time, yes.
Wow.
Because
2 birds with 1 stone.
That's actually multiple birds with 1 stone.
Because you lower inflammation as well. So if you have gout or whatever, then rheumatoid arthritis, you see improvement in the pain as well.
Exactly. Okay, so
you mentioned strategy to combine SimplyNaturePPARs together with is it the dietary regime?
Yeah, it's a
how to get the best effect out of
the best effect. So it's a whole protocol. So what I do, what I tell to patients is teach them how to do a whole food plant-based diet. exercise. How much exercise do you need based on your lifestyle? I know a lot of us are employees working and we really don't have that much time to, a lot of time to exercise. So I also advise you on how you can, inject exercise into your lifestyle. Okay, and on top of that, also use PPAR agonists or SimplyNaturePPARs to help you lower or catalyze or help you, burn those fats. Okay, so I know a lot of you are diabetic who are on medication. Please do not do this on your own.
Okay.
Especially if you are on medications, because you risk your blood sugar plunging down. Okay, you risk hypoglycemia. So you can experience dizziness. Some patients actually do experience blackouts. They lose consciousness because there's not enough sugar already. So please go for a consult so I can guide you on how we can remove your medications slowly. Okay, so it's a journey. It's not one-time thing. My last patient who I did this, he did it in 6 months.
Okay, and he's now drug-free.
Drug-free.
Was his diabetes level very high?
It's high.
He was a serious diabetic or moderate?
HbA1c is 9. So that is a high diabetic level. Okay.
Doc, my personal friend and one of the pioneers together with me in the industry, my partner actually, when we were in Singapore, his blood sugar level was 400.
Oh my God.
Yeah, when he went to the doctor looked at him and said, "Why are you still walking?"
Okay.
His blood sugar was 400.
Yeah.
And the doctor put him immediately on insulin
Yes,
shots.
exactly.
Yeah,
So,
but he actually was surviving and behaving a normal. He was just noticing he was losing weight because his body was burning all his fat.
Okay.
But he was surviving on actually PPAR powder extract. That's why he was still walking around.
Yeah.
All right.
Okay, so very important. Okay, go for a consult first so I can help you titrate down your medications. Okay.
For those of you who are wanting a special deal for the consult, we have one, right? So just type in that you want a consult with Dr. Jansen, and Sheila or Shay or any one of our HCS will actually get to you. Simply Nature is partnering with Simply Consult to make this possible for you. So there is a way for you to get a free consult. So if you were planning to get Simply Nature PPAR tablets and reverse your type 2 diabetes, don't miss out on the free offer to get a consult for free with Dr. Jansen. And as Dr. Jansen said, if you are on medication, it's best to do it with a doctor at your side.
Yeah, exactly. Okay.
Doc, before we go, you told us that the American Diabetes Association has actually a standard to let you know whether you have reversed your type 2 diabetes. You promised to share it before you go, right? So,
okay, so here it is. All right, so this table shows you the different types of remission status. Okay, so by remission, we mean that you are already not on any diabetes medication. Your blood sugar is non-diabetic levels already, and you have been on it for a period of time. Okay, so first, partial remission. So partial remission is you have no medications at all, taking anti-diabetic medications, no, and your glycemic threshold is non-diabetic already, but you are still on a pre-diabetes level.
It means still a bit high, but not diabetic.
But not diabetic. So this range would be for the fasting blood sugar. This range would be at 100 and 125 level.
Okay.
But you are not on medication, and you have been
medication
like this for at least 1 year. So that is partial remission. Now, what is complete remission? Complete remission is your blood sugar levels are already normal, so that is below 100. You are not on medication, and you have been like this for at least a year. Okay, so that is complete remission. Now, a prolonged remission criteria would be you are not on any medication, your blood sugar is not high, your fasting blood sugar is not high, and you have been like this for at least 5 years.
Wow, so
Okay.
this is the evidence. If they have criteria, it means it can be reversed
Yeah, it
because
can.
there's a standard.
Yeah.
Wow, thank you so much, Dr. Jansen. To all the diabetic patients out there, I think this is the best news ever. There will be one day soon, with the help of Dr. Jansen and Simply Nature protocols, that you can eat your ice cream. That you can eat the food that you want because you've successfully managed your type 2 diabetes and reversed it. So don't wait. Click on that button, type in you want a consult session with Dr. Jansen, and get your type 2 diabetes under control. Any last advice, Doc?
Okay, what I have presented to you is the goal, right? So the journey is the most important one. Now, in order for us to be successful, we have to be consistent. Okay? So number one, listen to the protocol. Do the protocol. Do not add anything or mix.
Do not add iced tea to the
iced tea,
protocol.
okay? So yeah, and another thing is we have to be consistent because because success comes in what we do consistently, and not in what we do occasionally. Okay? So one last thing. Again, please do not do this on your own, especially if you're on
If you're on medication, don't do this on your
own. Please book a consultation so we can help you out.
Last but not least, for all those listeners out there who have older parents who are diabetic, high blood cholesterol, and we are still in COVID-19, please, we schedule a consult with Dr. Jansen so that they will be convinced, get them on a protocol. You can make sure that they do well, they're no longer diabetic, and you don't need to worry about COVID-19 affecting them. And of course, to those of the many Filipinos who are diabetic and don't know it yet, but you suspect that you are, please start on the protocol so that you can go to work, so that if you are COVID positive, you don't need to worry that you end up in ICU or anything like that. That you will be the 99% of the people who actually recover from COVID-19. So stay safe, and remember, we are always with you from start to healing. Bye!